All right, everybody, welcome to today's travel health and safety session. I'm just going to do a quick introduction here. So my name is Julie, and I am your host today. I'm also a pharmacist out of Uric Pharmacy in St. Thomas. That's located at 519 Talbot Street. Joined here with me is Steve, who is the pharmacy manager, also at Uric Pharmacy St. Thomas, and Vishal, who is the pharmacy manager at Uric Pharmacy's London location, located at 555 Wellington Street. So we've got a bunch of content to go over today, and I'm very excited to go over all of this with you, along with Vishal and Steve. So without further ado, let's just get right into it. So travel medicine. Why is travel medicine important, and why should you get a pre-travel assessment, Vishal? Sorry, Vishal, I think your mic is muted.
So travel is an exciting activity to partake in, and today's travelers seem to be exposed to more risks than they have in the past. There are quite a few factors that contribute to this, some of them being an aging population. Global warming has a role to play. Also, ease of travel makes it easier for us to travel to locations that weren't accessible in the past. So it is recommended to get a pre-travel assessment with your family doctor or a healthcare professional at least 6 weeks before you travel, so that you can assess risks that are inherent to you due to your own personal health, and risks that you would be exposed to due to your destination. The government also has a very helpful website, www.travel.gc.ca, where you can get up-to-date information about health risks with regards to your destination, specific infections that you may be more at risk for, and also if there are any immunization or vaccination guidelines for your destination.
Yeah, so vaccinations might be a part of that pre-travel assessment. So Steve, could you maybe share a little bit on why vaccinations are important, and what are some of the important vaccines to keep in mind when traveling?
Absolutely, Julie. Everyone knows that I'm a big fan of vaccinations. I strongly believe that they have done more for society in preventing disease than any other measure other than clean water. It's really important to make sure your vaccinations are up to date. Many of us don't even know if our routine vaccinations are up to date. So we try to break these into sort of three broad groups. One is, as I say, the vaccination you should have. So that would be your flu shots, making sure your tetanus is up to date, making sure that you've got your, required COVID shots and other vaccinations that, may be warranted for based on your age and your activity. The second group are things that we recommend based on travel. So, for example, if you're traveling to an area where hepatitis A may be, a greater risk, sometimes they'll recommend getting that sort of vaccination. And it's really important to do that ahead of time because many of these vaccinations can take time to have their effect. So, for example, if we're talking about hepatitis A and B, it's a standard, 0 or now 1 month from now vaccination schedule, and then a booster shot 6 months down the road. But those first two shots are really important to get them done at least 2 weeks before travel. Similarly, if you're taking something like Dukoral, which is for traveler's diarrhea and cholera, the schedule is very straightforward. One dose, a dose a week later, and at least 1 week before you travel. The last group of vaccination, for those people who go to those more exotic countries, and you always want to check with the host country that you're going to because there may be required vaccinations, such as, for example, yellow fever, that would be required to enter into that area. And I stress it's really important to get that information ahead of time because some vaccinations like yellow fever, you can't simply get anywhere. You actually have to go to a clinic that does that type of vaccination for you.
Awesome. Thanks for sharing. Just a reminder to all of our viewers out there, if you have any questions related to travel health, travel safety, or even sun safety, drop a comment down below and I will bring it up with our amazing pharmacy managers. Vishal, the next question is for you. There is some buzz about, vector-borne illnesses. What is a vector-borne illness?
So a vector is basically an organism that can play a role in transmission of a disease, whether the transmission occurs between humans or it could happen between an animal and human beings. A great example or a common example are mosquitoes. So mosquitoes are a very important vector to be aware of. The Anopheles mosquito, for example, is one that is an important vector for a disease like malaria. Mosquitoes can also be vectors for diseases such as chikungunya, dengue fever, and Zika, which is a virus. So a traveler's risk of exposure to a vector depends on the destination again, and also depends on where you'd be staying, for example, the duration of the visit, which again would play a role in how long you'd be exposed to a specific vector, and also what kind of travel you'd be doing at the destination.
Awesome. We've actually got a question from a viewer. Jatan asks, is travel vaccines different based on the country that we travel to? Steve, could you maybe shed a little bit of your expertise on this?
Yeah, that's a great question, Jatan. And I will say that keeping up to date on what the risks are in the country you're going to is really paramount. Some countries, they may not have a risk this year, but as we know that global warming is occurring, migration of people, we definitely can see that the vaccines we might have recommended 10 years ago may not always apply today. So again, another really good reason why you want to get this assessment done ahead of time and make sure that you're getting the most up-to-date and current information. Thanks for that question, Sean.
Yeah, wonderful question. Let's keep the comments coming if you have anything that you want to know about travel medicine. So going back to vector-borne illnesses for a second, Vishal, how can we reduce the risk of contracting vector-borne illnesses?
Excellent question. So we will be exposed to vectors of some kind. So we have to take necessary precautions to limit our risk. Some risk reduction measures include, for example, sleeping in a well-screened or air-conditioned area. This would, for example, reduce your risk to getting exposed to mosquitoes. On the topic of mosquitoes, sleeping under mosquito nets, preferably those that are being treated with some form of insecticide, such as permethrin, or even wearing clothing that provides good coverage, long sleeves, trousers, socks, and using insect repellents. In regions where waterborne vectors are a concern, you want to avoid contact with stagnant water, for example, which might be contaminated. When hiking, for example, in areas that have ticks, wearing closed-toed footwear, pants that are tight and well tucked away. And also, it would be a good idea to check for burrowed ticks, especially after you're done with a hike, or if you're in the middle of a hike and taking a break, it would be a good idea to check for that as well.
Awesome. Yeah. So you mentioned a little bit about insect repellents in your little blurb there. Steve, could you maybe elaborate a little bit more? What are some tips and tricks for someone looking to purchase an insect repellent?
So again, we would recommend what Health Canada suggests, predominantly looking at something that contains DEET, so that's DEET, or acaridin, which is another type of insect repellent. Some of the natural choice, I know people always ask me about, using natural choices, something that is not harmful, that sort of thing. I generally discourage them from using something like that because although things like different oils, and that may sound like a wonderful idea, they definitely aren't always the best idea when you want to have as Vishal said, your maximum protection and making sure that we're not going to be infected with any of these vector-borne diseases. How long these things will last all depends on your activity, the concentration of the product you're using. And so, I always tell people to, follow the instructions, reapply as necessary, and also taking other considerations. As Vishal said, clothing, netting can also be very beneficial. And there's some studies showing that DEET impregnated nets are more effective than plain netting.
Yeah, so Vishal, I'm going to toss the ball back to you. Mosquitoes and malaria are linked together, but could you, for people who don't really know what malaria is, just give a brief overview of malaria?
Absolutely. So malaria happens to be one of a pretty common and serious infection in predominantly the tropical and subtropical countries. As I mentioned earlier, it is a vector-borne disease, so mosquitoes are a vector for malaria. And unfortunately, malaria, if untreated, can be fatal. So it's quite a serious illness to keep in mind. So when traveling to an area where malaria occurs, you should always protect yourself and take precautions to protect yourself against mosquito bites. And if prudent, it would be a great idea to take anti-malarial medication with you, of course, under the advisement of your family doctor. The medication, a specific feature of the medication is anti-malarial medication needs to be started before you travel. And it's usually taken or started before you travel. You take it while you're traveling, and you actually take it for a period of time after you return as well. That's usually the normal course for anti-malarial medication. Malaria can be quite serious. Without appropriate treatment, it can have quite a significant impact on your respiratory and renal health, and it can be fatal, as I mentioned earlier. Symptoms usually appear within 14 days, or sometimes can happen many months after you even return from your trip.
Okay.
Yeah.
Steve, malaria sounds like a pretty serious illness to contract. Is there a vaccine for it?
That's a great question, Julie. So up to this point, we've never really had a vaccine against malaria. However, there's actually been 2 vaccines who have been developed in the past few years, which help to prevent the spread of malaria. Now, as I said, I'm a big pro-vaxxer, so a lot of people ask me, well, should I get my kids vaccinated against malaria if we're traveling somewhere? And the answer is probably not. The simple reason is that the vaccines are approved for children between the age of 6 months and 17 months. However, most of our children in Canada are not at risk at that age. The second thing I always tell them is that, as Vishal alluded to, the anti-malarial medications that can be prescribed by a doctor, or in this case now nurse practitioner, or now even a regular RN with training, are probably more effective than the vaccine will be anyway. Not to take away from the vaccine, it is expected that this vaccine will probably save, anywhere between 100 to 200,000 lives per year. Although malaria doesn't often kill someone who is a normal adult, it's most at risk for those people who are on the 2 spectrums, the very young and the very old. So in many of these countries where malaria is prevalent, we often see young children under the age of 5 dying from something that is, in this case, preventable.
Mm-hmm. All right. So we've got some more comments from our viewers. So Reza asks, we're going to Florida with our kids and grandkids aged 4 and 2 years old in a couple of weeks. What precautions do you recommend for everyone before we leave? Maybe Vishal, you can answer this?
Certainly. Thanks for the question, Reza. So that sounds like an exciting trip that's coming up. In terms of precautions, you want to make sure, again, that you're all immunized. With regards to immunizations, you want to make sure you have your flu shots done, and might be a good idea to have your COVID boosters. If you haven't had them done already, it might be a good idea as well. Depending on what kind of activities you'd be partaking, there may be specific things you could do with regards to protecting yourself in relation to the activities that you're doing. Having a good enough supply of insect repellent if you're going to be outdoors and hiking, for example, and if it does happen to be hot and humid, that Florida typically can be, that might be a great idea as well.
Awesome. We've got another question from another viewer. Her name's Carol, and she asks, she's traveling to Jordan this summer, and her family physician does not practice travel medicine. Is it therefore necessary to visit a travel medicine clinic for a thorough plan? Maybe Steve, you could take a stab at this one.
Yeah, I would definitely encourage it. Many family physicians, part of the issue with travel medicine is that they're not reimbursed for the time that they spend, and it does take a considerable amount of time to review risks and making sure that everything is up to speed. Obviously, it's a fairly significant trip you're taking, so you want to make sure that you have all your precautions done ahead of time, so that way your trip is most enjoyable.
Awesome. Thank you so much for the questions, everybody. If you have any more, be sure to keep them coming. All right, next up, so water safety. What are some concerns about water, and what are some tips that you have for water safety, Vishal?
Excellent question. So as Steve mentioned earlier, safe water has a tremendous impact on your health along with immunizations. So safe drinking water is absolutely essential when you're traveling, especially when you're visiting foreign countries. Drinking unsafe water can be one of the biggest causes of getting ill, and can result in acute infection. This can happen within hours, or it may take a few days, and it can really put a full stop to your traveling. So, some of the diseases that are associated with traveling, they can be viral, they can be bacterial, amoebiasis, for example, cholera, hepatitis A. Typhoid fever. These are all illnesses that you may have heard, and they are all a reason due to drinking unsafe water. So wherever possible, the golden rule is always try and stick with bottled water or processed water wherever possible. And it may not be as simple as just buying a bottle of water. You want to make sure that the bottle is completely sealed, or there's a plastic wrapper on it to make sure it hasn't been tampered with. So you want to be diligent and make sure you're drinking safe water. If you're buying bottles or cans, maybe it would be a good idea to maybe wipe the lid off to limit how many contaminants you're ingesting. Another source of contaminated water that flies under the radar are ice cubes. So if you happen to be at a resort or a restaurant, and you may be sipping on or drinking bottled water, but if the drink you've ordered has ice cubes in it, and the water used for the ice cube is contaminated, you're still essentially drinking contaminated water. So you want to be careful with ice cubes as well. If you don't have access to bottled water, what's the easiest thing to do? Just boil the water. So boiling is a simple and extremely effective way to purify a source of water. Ensure you boil the water vigorously for at least a minute, and excuse me, let it cool to room temperature before use. You could also use filters to filter sources of water. Most camping and outdoor sports stores carry water filters that you could buy very easily. And also, it's a good idea to frequently hand wash and essentially use clean water to wash your hands. Otherwise, washing your hands with contaminated water, you're still in trouble.
Absolutely. All right, we've got another question from a viewer. This is from Rosalind. Are there any travel recommendations you have for traveling to the United Kingdom? Steve, do you have any comments about this?
Well, as Vishal said earlier, there's a great website, travel.gc.ca. And I often recommend people go there first. If you go there, you're going to find out that the UK doesn't have any necessarily tropical diseases you're worried about, but they will advise you about other risks. For example, terrorism, petty crime, talking about cybercrime. So as the UK is a developed area, much like Canada, the US are, they would advise you, precautions that you can take in those regards. So although no specific vaccinations are necessarily required to travel to London, there are some other things you may want to be careful about as far as, making sure that you're cautious with your personal information, because that could also be a good way to ruin your trip. Thanks, Ro, for the question.
All right. The next question we've got, what are some tips when traveling with medication? Vishal, could you maybe share some tips?
Absolutely. Excellent question again. So, if you're taking medications with you, there's quite a few things you could do to ensure you have a smooth trip with regards to your medication. So, number one, I would probably say make sure all of your medication is in its original labeled container. This would save you from a lot of questions, especially when you're traveling with regards to customs and border patrol at your destination countries. Always pack extra medication if possible, in case your trip turns out to be longer than you anticipated. That way you don't run out. Carry a copy of your original prescription if possible, or at least if not, most pharmacies will give you can give you a copy of your medical record fairly easily. So it might be something to ask your pharmacy for before you leave. If you have specific medical conditions that have specific medical needs, it might not be such a bad idea to have your doctor give you a certificate to explain a specific medication or a medical device, for example. An example for where you may need this is for injection supplies with specific medication. If you happen to be flying, or if your trip involves flying, always a good idea to keep your medication in your carry-on versus your check-in luggage. That way, there's chances your check-in luggage might get lost, but at least your carry-on will be with you on person. So at least you're making sure your medication is with you. Also check with regards to airlines. You might want to check and see if your airlines has specific protocols or specific rules with regards to carrying injection supplies, for example, or needles. You can also ask your pharmacist for compliance packaging to make it more convenient. So if you have several medications that are in vials and that might not be so conducive to traveling, your pharmacy could compliance pack your medication and consolidate it in a more easy or more travel-friendly way of carrying your medication. So that might be something to consider as well. Yeah, I think that's a few tips for consideration.
One thing I will add is to check with the country you're going to see what restrictions are on the medication you're taking. I had a lady who traveled to Australia for 6 months, and she was allowed to bring only 3 months of one type of medication, her pain relievers, and then had to make arrangements to find a physician in Australia that would prescribe. So we spent quite a bit of time making sure that she had all the proper documentation, so that would go smoothly. And then as a CATSA, the Canadian Air Transport and Security Agency, is a great website. There you can look up items that you're allowed to bring on travel. So with Mr. Alavi, who's heading down to Florida, if he's flying, he can look up to see what he's allowed to bring on the plane with him. So those are some kind of tips that also may help you to have a more successful trip.
Awesome. Thanks for all the tips, guys. There is a question from a viewer. Danny asks, is there a restriction to donate blood if I travel outside of Canada?
I'm happy to address that if you like. So okay. First of all, great picture of the kids. They're so cute there. So one of the sites I often recommend people to is blood.ca. So that is the Canadian Blood Services website. On there, you'll find information about what restrictions there are as far as which countries have, for example, a malarial risk. In general, the waiting period for traveling outside of Canada, I believe, is 21 days. And again, that just is to prevent any risk that you may be bringing back a vector-borne disease like Zika or something like that it would put you at risk. If you have contracted malaria or a disease like that, there may be restrictions, or likely restrictions on blood donations, but then you also might be able to donate plasma. which of course is a very important part of our blood products. If you don't have access to the website, you can actually call their 188 number. It's 1-888-2-DONATE, and someone there will be glad to help you to make sure that you're making the best informed decision, and then also help you to book an appointment for an upcoming clinic. We have them every month here at the Joe Thornton Arena here in St. Thomas, and I highly encourage people to donate if they're able.
Thank you so much. Yes, everybody should take a look at the eligibility criteria and see if they're eligible to donate blood. All right, next up, I've got a question for you, Vishal. What should I keep in my travel first aid kit?
Ooh, it's a great idea to have a travel first aid kit. So, yeah, excellent question. You want to make sure you keep some space aside in your luggage for a travel first aid kit. With regards to what you could have in it, you want to essentially carry a mini pharmacy with you. So on top of the list would be your analgesics, so your acetaminophen, your Advil for like a headache or body ache, fever, pain. You might want to keep some antacids with you since you may be eating out or trying the local cuisine. So for indigestion or heartburn, some Tums maybe. Antidiarrheal medication, another excellent choice to have on you. Imodium is a good choice to make sure you have some with you. Pepto-Bismol is another one. Might not be such a bad idea to have some antihistamines for a runny nose or fever or allergies if you happen to be outdoors. Reactin, Claritin, Benadryl, all good choices. Reactin and Claritin would offer an advantage against Benadryl. Benadryl may cause some drowsiness, whereas Reactin and Claritin tend to be non-drowsy. Some decongestants, either in the form of tablets or in the form of nose sprays in case you end up with a stuffy nose. Probably some topical antiseptics like polysporin for cuts, for some minor cuts or bruises. Some anti-nausea medications if you happen to be on a cruise, and if you're sensitive to motion sickness, some motion sickness or anti-nausea medication would be a good idea as well.
Awesome. Next question we've got.
I was going to add to that, Julie, maybe a thermometer or a fever strip if you're traveling with children, just to know if you can sort of identify issues right away. And then the other thing that if you're traveling with a person who is on an opioid medication, particularly high dose, it probably wouldn't hurt to throw in a Narcan kit. These are the things we're often recommending to people because we often think about people overdosing intentionally or unintentionally, but that can occur to anyone. So anyone who's on opioid medications, they inadvertently take more than they're supposed to. It's always just a good thing to have with you for a rescue medication to have on travel.
Awesome tips. Awesome tips. Next question is, what is a VTE? What does that even stand for? And how can we help prevent it? Maybe Steve, you can elaborate a bit on this one.
Sure. VTE in the simple form is a clot. In the more complex form is a venous thromboembolism. So it's a clot that can occur when blood pools. So when our blood pools, it starts to clot. And so if you're on a long trip, particularly as this lady was talking about going to Jordan, a fairly long flight, usually defined as more than about 4 hours. The legs, we don't really move around as much as we normally would, and there is a risk of a clot forming in the lower leg. Generally speaking, there's a lot of reasons why a person's at greater risk. As I said, because they're in more confined spaces, there's reduced oxygen tension and a lower pressure environment with air travel. People who are in larger body weights are also at higher risk. And then there are some people that just in general may have any genetic risk that put them at higher risk. So, there's some things you can do while traveling. For example, contracting the muscles of the calves regularly while in flight, getting up and trying to walk around when it's safe and you're able to. In some cases, they'll recommend below the knee compression stockings. And it's normally for those people that are at higher risk. So they don't commonly recommended for the average traveler who has no risks. And then finally, those people that are very high risk may want to talk to their doctor about possibly being on an anticoagulant medication. But again, that's those people that are really at higher risk, and we don't recommend it for the average traveler.
Awesome. And I just wanted to quickly add to that. So a lot of people think about long flights as being highly associated with possible blood clot formation, but something that not a lot of people think about is road trips as well. So if you're sitting in a car for more than 4 hours and you don't really have the space to, contract your legs or move around, that could put you at an increased risk for a blood clot as well. So same tips, same prevention tips would apply in those cases.
Absolutely.
All right. So the next question we've got here, let's talk sun damage. So how does sun-induced skin damage occur? Maybe Vishal, you could share your thoughts on this.
Absolutely. Sun causes damage because the light that comes from the sun contains UV or ultraviolet radiation. So it's the ultraviolet radiation in the sunlight that actually causes the damage to the skin. So the UV radiation is actually of 3 types. There's UVA, UVB, and UVC. These designations are simply to do with the wavelength of the parts of the UV radiation. So that's why they've been split up. Why these are significant, or why each one of these is important, is because each one has the capacity to cause damage at different levels. So your UVA is the one that's highly penetrative. It can penetrate clouds, it can penetrate clothing even, and it has the ability to penetrate the deep layers of the skin. Inherently, your skin obviously does give you protection against ultraviolet radiation, but the longer you are unprotected and exposed to sunlight is when damage starts happening. Now, the UVB can penetrate water, but it does not penetrate as deeply as UVA does. And in terms of skin damage in general, it's the UVA and UVB that are most clinically significant. The other important thing to know about with regards to sun damage is it can happen to people of any skin color. It can be acute. It can happen, when there's short duration exposure to the sunlight, or it can happen when you are repeatedly being exposed to the sun as well. So when there is any kind of sun damage, you're typically looking at symptoms like some redness. There may be swelling of the skin. There may be pain, especially the more the damage there is. There may be the pain may be present as well. If there's a severe sunburn, there may be blistering as well. So sometimes people will notice that as well. Why it is important to protect against sunlight is because chronic exposure to sunlight, that's when you start having real long-term effects such as pigmentation changes. And in really severe situations, you're looking at potentially having precancerous lesions or skin cancer as well.
So that sounds like pretty serious damage that could occur. Steve, do you have any tips for how we can stay safe and prevent skin damage from the sun?
Absolutely, Julie. So, I mean, knowing when the UV radiation is at its worst is usually a good way to sort of prevent it. So, generally speaking, in our climate, between the hours of 10 and 4 is when the UV radiation is at the highest. So, try to limit your activities when you be out in the sun during those times. When we were younger, of course, it was very common that we would leave in the morning and come back at supper time. And I don't think my parents ever touched sunscreen. Nowadays, I think we're more knowledgeable about that sort of thing. So making sure that if you are going to be engaging activities outside during this time, that you're using sunscreen, and making sure that you're getting one that has a high SPF factor. So SPF factor of 30 or greater. And also really important that you do apply sufficient amounts. In general, they say that for your body, you need about a shot glass version of sunscreen. So that's a fair amount that you'll need during that time. You also have to make sure that you're reapplying it frequently. And that a lot of depends also on your activity levels. So what you're doing. So if you're playing sports where you're sweating, you may lose some of that protection a little more quicker. If you're in the pool, or as my kids are at the beach, in and out of the water, those are the times that we often forget about it, and then we have to then reapply. For anyone who's under the age of 6 months, we just generally avoid, covering up. Clothing can be has its own SPF factor. I think a jean jacket has an SPF around 55. So making sure that you are, wearing clothing during that time that will protect you and protect your children certainly can help to prevent it. As I always say, an ounce of prevention is always worth a pound of cure. So, use that prevention as much as you can.
Absolutely. Okay, now we're getting a couple more questions from viewers. This one, This one is from Morag. What do you recommend to use for ear pressure on an airplane when taking off and landing? Vishal, do you maybe have a recommendation? Oh, sorry, you're on mute.
Sorry, one of the easiest things you could do is chewing gum, or sipping on small amounts of water if possible. So the action of yawning or swallowing, generally this helps relieve some of that those pressure changes that cause that ear popping or that ear discomfort, especially during takeoff and landing. Some other tips that I could share are using filtered earplugs, for example. These have also been known to help protect your ear canal against some of those pressure changes as well. Another recommendation that somebody had personally shared with me was try your best not to sleep when you're taking off or landing, simply because you can actually do some of those other things if you're not sleeping in the first place. So.
Awesome. Great recommendations. It looks like someone also added that there is a product called Earplanes that you could purchase that has helped for them. So that could be something you look into as well.
Thank you.
Yeah. So I guess we'll just wait a couple minutes just to see if there are any last minute questions from the viewers. All right, I'll let the viewers have another couple moments to ask any questions if they have any, but just to sum up, this was a great session on travel health and safety. We went over various different vaccines that you should consider, how much in advance you should consider booking your travel consult at a travel clinic. We went over things about malaria, and we went over the upcoming malaria vaccine that they have developed. We've gone over, water safety, and we even touched on a little bit about sun safety as well. So overall, amazing discussion today. And with that, I see we have no further questions from the audience. I would say, job well done. And thank you so much for attending our Facebook Live.
Thanks, everyone.
Thank you. Great questions. And thanks so much, Julie, for moderating.
Happy travels, everybody.